welcome back. Well, our next guest is an expert in eye care innovations and cutting-edge technology. But he doesn't just provide excellent care in Wisconsin, he gives back through mission work in Central America to provide eye care for those in need. Joining us right now is Dr. John Vukich. He is a refractive surgeon and founding doctor at Summit Eye Care of Wisconsin. We're so excited to have you back, doctor. Good to have you here.
Oh, thank you. It's a pleasure to be here.
Yeah, I always love kind of catching your ear, even off camera, just kind of talking to you. You're such an interesting person. But you've been doing this for so long, and traveling back and forth to and from Central America from Wisconsin has been something you said you've been doing for a very long time.
Yeah, almost 20 years.
20 years.
And so the profession of eye care is such an amazing profession. There's so much innovation, there's so much opportunity, but it really changes people's lives. And there's so much need around the world that to be able to provide that opportunity for others has been a very nourishing part of my career.
Yeah. How has it evolved over the years, providing care in other countries and the opportunity for people to be able to see?
Well, and that is a really important question. So the whole idea of like mission work, meaning traditionally doctors would go, they'd set up camp and they would take care of 100 patients and feel very good about that. And of course those patients' lives were improved, but they would leave and it really didn't leave behind any durable opportunities. So we've really evolved now into more of a teaching mission. So when I go there, I am helping the local doctors. I'm providing resources as well as instruction. We bring in other surgeons as well. And the idea is to train and to provide local, durable opportunity for improvement in the quality of care.
See, I love that, because it's kind of like what they talk about with food missions. If you just come in and, you know, provide food for a short amount of time, the longevity of that goes away. That you're not providing something for the next generation, and so the people who go in and create, you know, some sort of garden or some sort of thing like that. It's a similar idea of teaching the other doctors, teaching people there. Super important. I know that's a big part of what you do as a doctor. You're also a clinical researcher, so you're so involved in cutting edge technologies that you've brought here to us in Wisconsin, but also that you're doing a lot of there. So describe, you know, the charity work that you're providing and how that maybe is different from mission work, or are they kind of the same, charity and mission work?
Well, they're both interconnected.
Okay.
So what we have done is we've tried to provide local care and instruction, but we've also tried to provide the resources and the surrounding infrastructure that supports that. So if you come and you do surgeries and leave, you've not left behind the people who would service the instruments or who would provide the equipment that's needed locally. Really what you've left is okay, we'll wait another year till they come back.
Exactly.
And so the whole idea of charity care has completely evolved. So when we go, no one pays zero. Everyone has some involvement. And so about 40% of the patients that we consider charity, they pay $1 for their surgery.
Really?
And if they can't afford $1, we loan it to them and their family can work it off, often by sweeping the pews of the local church or what have you as an opportunity. Others would have a maximum. And the way we determine what the price will be is we give a questionnaire. And we say, where do you get your water? From a well, from a sink, from the local river. What is your roof made of? Thatch, tin, or clay? And so very proud people, and they want to participate, but we can then decide, all right, this is what we would do. We also make it clear that for the individuals who are better off, and quite frankly, the people who live around them, they know that that's the person who has a little bit more. We make sure that they know that, yes, they charged a little bit more, but what we were able to use that proceeds for funded the surgery for the others in your community. So it becomes synergistic.
You know, I think we're so privileged here. We kind of think about the fact that questionnaire is not something any of us would ever have to answer.
That is
you
true.
know, just thinking that somebody who drinks water from a sink is wealthy, you know, in a country that you're going to in Central America. That, I mean, it puts so many things in perspective. So when you talk about the procedures and the work you've done, how many procedures have you been able to do? Do you keep track? You got like a little tally list, or?
We do, and quite frankly, the government keeps track as well.
I bet, yeah.
Because they see this as a huge benefit to both the infrastructure for healthcare and as their ability to, you know, provide well-being for their citizens. And so, yeah, we have done cumulatively over 8,000 surgeries. And I say we, what I'm talking about is the surgeons that we have trained, the ORs that we have set up. We provide funding for and equipment for over 25 different ORs that we've set up, trained surgeons, and when they get to a certain level of proficiency, we provide them with donated materials, with donated equipment in an OR, and in return, they have to agree to provide 40% of their cases as charity under what I just described.
Yeah.
And for cases that they're uncomfortable with or maybe beyond where their comfort of training is, they come back to where we do our main surgeries, and so now we have this infrastructure for tertiary care and training of specialists, retina specialists and cornea specialists. So it's become very synergistic in terms of the infrastructure.
And you said you go almost every 6 weeks at this point.
Yes, exactly.
It's pretty incredible. How is it funded?
Well, that's an excellent question. Of course, we always are hoping for donations and things,
Yeah.
but really that's not what this is about. We fund this. There is some support from the government. There is some support from industry. And you had mentioned that we do some clinical research bringing new technology, and that then provides funding for the charity care that we provide.
So we're out of time, but real quick, just give us maybe a sentence or something you've heard from someone who's received the care that you provide and how their life has changed. What do they say to you?
Well, it's not only their life that's changed, it is the life of the family.
Yeah.
Inevitably, if someone is cataract blind, it is almost without fail, it is a younger grandchild, almost always a woman, sadly, who doesn't go to school, who's there to
Yeah.
take care of grandma. Okay, we then take that necessary relationship and say, all right, now the grandparent can see. We've freed up someone else to continue their education and better their life, and they become a productive member. It is very much downstream. The good goes beyond just the person, which obviously is important.
That ripple effect and that feel good that you're doing, that's pretty incredible. So thank you so much for joining us, Doctor. And you've got an incredible way for all of us to be a part of your mission, because for the next 3 months, any patient electing to have refractive surgery at Summit Eye Care of Wisconsin, Summit will match by donating the funds and resources for someone in need with cataract blindness like the doctor just talked about. To learn more about premium cataract surgery or LASIK for you and yourself, visit summitiwi.com. You can also call them to learn more about this mission or for your own health, 414-877-6414.